Do you need your gallbladder removed? Hi, I'm Dr. Fan, Australia-based surgeon talking about gallbladder surgery. Your gallbladder is a little pouch located between your liver and small bowel. It stores and releases bile, which helps with digesting fats. The gallbladder can be removed in an operation known as cholecystectomy. This is normally done keyhole or laparoscopically and is one of the most common operations in the world. During the operation, we take your gallbladder off your liver and bile duct and then remove it through the tiny keyhole incisions. After removing your gallbladder, you may not digest fats as well as before. However, most people won't have any issues because the body adapts very well without it. In fact, you should feel better. That's because the gallbladder makes gallstones, which can block the ducts, causing pain, infections, and even pancreatitis. Whilst it may be great to remove your gallbladder, you do need to know about the risks of the surgery. Bleeding. Surgery involves cutting and therefore bleeding. We actively look out for bleeding and will stop the bleeding before the operation finishes. Occasionally, there is bleeding that is not apparent during the operation. Small bleeds often stop themselves, but we may need to give you a blood transfusion or even take you back for another operation to stop the bleeding. Infections. Infections may occur at the site of our incision or deep in your belly. If there is a deep infection, we can treat it with antibiotics, drain it under ultrasound, or drain it in another operation. Tained stones. Sometimes gallstones fall out of your gallbladder during the operation. We would usually notice stones falling out and retrieve them during the operation. Occasionally, they get lost and stay in your belly permanently. Rarely, those stones that fall behind can get infected, causing a delayed infection. This can also be treated with antibiotics and drainage. Bowel injury. Very rarely, the bowel gets in the way of our surgery and surgical equipment, which can cause a bowel injury. If we find this, we can repair it during the operation. However, sometimes the injury is hidden and we may need to take you back for a second operation. Contrast allergy. We often use contrast dye to check your bile ducts. Very rarely, people are allergic to the contrast and can have an anaphylactic reaction. But if you do have an anaphylactic reaction, the operating theatre is the safest place to have it, surrounded by anaesthetists and other medical staff. Conversion to open surgery. If we cannot safely see the gallbladder, or if there is a complication, we may need to convert your keyhole operation to an open operation. This may involve an incision under your right rib or an incision down the middle of your abdomen. We rarely need to do this these days. Adhesions. Anytime we operate, we cause scarring inside the abdomen. This scarring can lead to adhesions, where the bowels can get stuck together. If this happens, you may develop a bowel obstruction where your bowels are blocked at the area of the scarring. This may happen even years after the original operation. In most cases, the bowel blockage will settle down without an operation, but you may need an operation to remove the scars. Ironically, the subsequent operation then creates new scars. Hernias. Anytime we make a cut in your belly, we create an area of weakness. Even our tiny keyhole cuts. It is possible that you may develop a hernia through these cuts, known as incisional hernias. This occurs when something inside your belly, such as bowel or fat, tries to escape out of the belly through the previous incision. You may need another operation to fix these hernias. Bile duct injury. The bile duct carries bile from the liver to the small bowel. The gallbladder attaches onto the bile duct to store and release bile. Very occasionally, during removal of the gallbladder, the bile duct may be injured. If this happens, you may need complex surgery to reconstruct your bile duct. And even after reconstruction, you may have long-term complications with blockages and infections. Fortunately, this dreaded complication is uncommon, about 3 in 1,000. Even though there are quite a few things that can go wrong, most gallbladder operations have no complications. In those cases, you can go home the next day and return to work when you feel up to it, which is potentially the next day. If you have an active infection, such as cholecystitis, or experience some operative complication, you may need to stay in hospital for a few more days of monitoring. After going home, some people do not feel 100% for up to a few weeks after their surgery. We will generally follow up with you 2 to 4 weeks after your surgery to assess your recovery and discuss your results. At any stage, if you feel not right, you should come back to us and we can assess you for complications. In most cases, there are no issues, but we will all feel better after some reassurance. The stitches we use for this operation are all dissolving, so there is no need to take them out. We will generally ask you to keep your operative dressings on for a few days to keep your wounds clean, and ask you not to go swimming for 2 weeks until the skin fully closes over. We will also advise you not to do any heavy lifting for 6 weeks after your surgery to reduce the chances of you getting a hernia. Well, I hope that you know more about keyhole gallbladder surgery. Check out these other videos for details regarding surgery and anesthesia. Comment below if you've had your gallbladder removed and what was your experience.